Earlier this month, congressional Republicans and their supporters across the country celebrated the passage of President Trump's large tax and spending policy bill. Hundreds of pages of tax cuts and budget increases for certain agencies, as well as nutritional regulations and investments into rural America. Cuts to Medicaid. That's one of the big issues kind of tucked into this, specifically cutting off reimbursements for any organization that provides abortions. A legislative way to defund Planned Parenthood in the name of stopping wasteful spending. Although one person's legislative tactic is another's illegal tactic. Just yesterday, a federal judge put a stop to that plan, at least temporarily. Still, Planned Parenthood in Idaho says the confusion is causing a clear rippling effect.
The complicated web of federal funding and reimbursement payments to Planned Parenthood has a new development.
A federal judge issued a preliminary injunction that blocked that provision in the reconciliation bill that unconstitutionally defunded Planned Parenthood from going into effect.
It is a temporary decision, but one that Misty Delicarpini-Tolman, Idaho State Director for Planned Parenthood Alliance Advocates, says her group is working to explain to impacted patients.
We are constantly concerned about the message that the public is receiving from various headlines they're seeing on social media or in the news, and we're doing our best to educate the public.
Planned Parenthood says the initial news of the funding change certainly sent emotional waves through their health system.
There was quite the chilling effect across the community who didn't know if they could go to their trusted healthcare provider to get the care that they needed.
Planned Parenthood and other prohibited entities can once again receive Medicaid reimbursement for now. But the weeks since the law was enacted showed what the future could hold depending on the court's final decision.
There will be cancers that go undetected. There will be STIs that go untreated and therefore spread. People won't be able to access the birth control, abortion care that they need to be able to plan their families and their futures. And that safety net that exists within our health system will be destroyed across the country.
The reconciliation bill, also referred to as the Big Beautiful Bill, put the funding rules under a cost-cutting subheading. Critics say it goes well beyond that.
To be really clear, this law is not about fiscal responsibility, the way they're trying to tout it. Abortion is already excluded from federal funding. This is a targeted ideological attack on healthcare and on healthcare providers that might provide abortion access elsewhere.
Elsewhere is a key in Idaho, a state that already prohibits abortions and public money that goes towards it. The reality, advocates say, this would compromise a list of other healthcare benefits for thousands of people.
We've expanded our services to include vasectomy care and menopausal care. So things that people are going through every day in their lives and wanting to go to a trusted name, a trusted healthcare provider.
Republicans in Congress and Idaho have been very clear. They are determined to prevent federal funds from supplementing abortion care as a political issue and as a budgeting item. Planned Parenthood believes that the concept will not stand in a court of law.
Defunding Planned Parenthood is an unconstitutional attack that will not only decimate abortion access nationwide, but will also harm the 1.1 million people with Medicaid who come to Planned Parenthood health centers for care every year.
So the court system will ultimately decide, and Planned Parenthood worries that if this causes closures of Planned Parenthood locations, that the medical system wouldn't be able to handle the influx of people that would be looking for new providers. They also worry that some people would just decide that their sensitive medical care, they're not comfortable finding a new provider, Brian. So again, this is an injunction at the federal court level. If it continues this way, I guess it's not out of the question this could go to the Supreme Court or something like that.
Yeah, so how is that different than what already went to the Supreme Court back in June that said states can take money out of Planned Parenthood through Medicaid?
Right, so it's the difference between federal distributions and state distributions. So this is a different mechanism at the same idea. And when you talk to supporters of the idea is that, we don't believe that this type of federal dollars should be going towards these programs, towards abortions. However, you hear in states like Idaho, and Idaho's not alone in this, the argument being, okay, well, we don't do abortions anyway. So it's kind of the guilt by association. So I've seen some people question, what if Planned Parenthood called themselves something else in Idaho? Not something that is likely going to happen, but it is a nuanced conversation for sure.
So you said this could go to the Supreme Court, but they've already kind of given an indication of which way they would lean on this decision.
Yeah, we've seen a clear indication from this Supreme Court on how they lean and how they rule. So Planned Parenthood had a few weeks into the window of what is the reality here. It's paused for now, and that pause could go on for quite some time, or it could be overruled by a different court.
All right, thanks, Judge. Or Judge Joe.
No problem.